Governor, I wanted to follow up on the question I had asked Governor Pawlenty, but I didn't get a chance to kind of follow up with him. The reason I'm curious about this mandate question, because the theory, and I understand how Massachusetts are unique and all, I don't think anyone was asking to criminalize anyone.
No.
Criminalize with
Not at
automobile
all.
insurance. But my question stems from so many kind of comments that were made here is if you have managed care, if you can prevent the diabetes from getting worse, the cost of going to the emergency room when it's acute for those who don't have insurance, the fact that millions of the 47 million uninsured can't afford insurance, the youth that are living on Wall Street and doing well. So the concept has been that the mandate has the healthy as well as the unhealthy in the pools, and then you theoretically have the premiums go down because the healthy are mandated to be in it. The benefit also is less go to the emergency room.
Absolutely.
Because you've managed that care. So my question is, I know you've touched upon this, I think, in your plans, thinking of the 300% and above, because you would have subsidies, obviously, who those can't afford it, so that you could do that. So could you give me your opinion on this concept of mandate?
Well, I'll this business and this issue has reared its head in the political campaign. It's ludicrous to suggest that the poor are going to be criminalized or in any way punished or be in violation because they won't be able to afford it. For example, on Coverall Pennsylvanians, if you are 150% below the poverty level, if your family is, you get into the CAP program without paying a dime, And as you go above 150%, the monthly premiums rise for you. But if you're 150% and below, you get in without paying a dime. It's plain and simple as that. And Massachusetts was much like that, et cetera, et cetera, et cetera. Nobody's going to keep a poor person out because they can't pay. What the mandate was designed for, ironically, is to help everyone and to help the insurance companies. Because every one of those 28-year-olds, and there are plenty of them, If I was an assistant DA working for the city of Philadelphia, but if I had, when I went to private practice, I had my own little practice, I didn't have health care, I was 29 years old. But if something happened to me, I'd be treated in an emergency room. And that cost gets passed back to the taxpayer and to the ratepayer. No free riders ought to be the rule. It's absolutely basic, and as I said, we do it, and Governor Pawlenty's right. There are a lot of people who avoid insurance, but most of them don't avoid it because, some of them avoid it because they can't pay, but in this case, no one's going to have to worry about not being able to pay for it. So I think it's a fair system. And if you had an insurance company, the congressman made a good suggestion to have not just political people at one time, get a panel of one person representing everything. The insurance company guy would be waving his hand frantically and saying, well, if you're going to make us take someone with a pre-existing cancer, then you got to give us the 28-year-old. And that's right. Unless we want to go to single payer, and there are pluses and minuses to single payer. Unless we want to go to single payer, we have to do something that's fair and balanced for the insurance companies as well.
Governor, one other question that I'm intrigued by in watching in Massachusetts, and sometimes it's not just the theory, it's how they execute it. But the quasi-government connector that is permitted to take all these small businesses and pool them together to where, to some degree, you can Walmart it then through competition, having mandated that the healthy are in as well as the unhealthy. Again, the question was asked here, and I understood his answer is, I think what his answer was, well, I wouldn't proscribe anything. But yet, do you see value in pursuing that?
Sure. Absolutely. And by the way, I know the congressman who asked the question about the health savings account isn't here. If you are a small business and you offer health savings accounts to your employees, that counts. You don't have to go into Coverall Pennsylvanians. That counts. Even though I think when you get to lower income working people, health savings accounts are not very realistic. But still, we allow that to count. And certainly allowing, there are a lot of ways to skin the cat here, and allowing small businesses to group together are important, except the insurance company guy who's not here he'd be howling. He'd be howling because and by the way, one of the things, and I think this is important for both Democrats and Republicans in the Congress, we're not going to get a good system of affordable and accessible health care without stepping on the toes of the insurance companies. They're going to be forced to take some things they don't like. But they should understand that this plan, or what you're looking at, will step on their toes. Single payer is the death penalty for them. And they ought to accept the fact that everybody's going to have to sacrifice a little to make this work. I don't know if any of you saw this, and maybe it was just I thought I saw it on Washington TV, so maybe you did see it. There's this woman who works for one of the insurance companies that has gotten a series of bonuses because she has been tremendously successful in denying claims. She's been their single most successful person in denying claims. Again, sometimes you should deny claims. I'm not saying that, but the system is all out of whack. You know, you can't do that any more than what would you as a Congress say to Mary Smith, 35 years old, self-employed. She had a little health plan. She got cancer. The health plan coverage period ran out. She can't get coverage now. She was clearing $26,000 a year in her small business. She has no way of fighting for her life. I mean, what do we say to her? The richest country in the world, the only country that doesn't have some form of, the only developed nation that doesn't have some form of guaranteed health insurance. What do we say to that lady? Sorry, you're out of luck. It would be too tough for the insurance companies to pick it up. There's no catastrophic fund. The little state of Delaware has an interesting plan. They will, and this is impractical for the big states, they will cover 100% of the expenses in fighting cancer for any Delawarean citizen who gets cancer and doesn't have health coverage and can't afford health coverage. I asked Governor Minner how many it was, and it was like 732 people. You know, would that we could do that in Pennsylvania? You know, I would do it tomorrow. I mean, how do we explain that to people? You know, you have great coverage. I have great coverage. You know, how do we explain it? You know, I just don't think we can. So I would, again, urge the Congress, and I appreciate Madam Chair and everyone in this committee taking this issue seriously. I think it's the seminal issue of the next 10, 15 years in America, and you've got to solve it. And we will work with you in every way we can. I don't think we want to just absolve ourselves of any fiscal responsibility for the delivery of health care. We'll work with you on any reasonable system that's set up. But let's get this done. I mean,
thank you so very much.